Sweaty hands, racing heart, and so many people around that it looks impossible to get away. This is a condition known as agoraphobia. According to medicalnewstoday.com, in the article, What is Agoraphobia? What Causes Agoraphobia? Printed on 8/28/2009, about 3.2 million American adults are suffering from this phobia. Agoraphobia is a serious condition that it is surrounded by many misconceptions. In this speech, I will inform you about what agoraphobia is, what the signs are, and how to seek treatment if you believe you or someone you know suffers from agoraphobia. In order to treat any condition, you must first understand the condition itself. People suffering from agoraphobia are really just afraid of having a panic attack in a place where they will feel trapped and helpless. The panic attack can be so intense that a person may believe he or she is dying of it. The person will avoid all triggers such as crowded areas, standing in line, shops, shopping centers, and in some cases a person will not leave their home. While agoraphobia can affect anyone, there are certain age and ethnic groups that may be at higher risks. MedicineNet.com/agoraphobia, an article by Roxanne Dryden Edwards, claims that to a certain extent the condition is genetic, and women are more commonly diagnosed than men. It is also more common in some ethnic groups than others. Now that we know what it is, we can take a closer look on the signs of agoraphobia. Agoraphobia is a unique phobia because of the extent of the problem it can cause in a person's everyday life. People that suffer from agoraphobia will find it hard to complete tasks to meet their most basic of needs. Things such as grocery shopping and seeking medical attention will become severely, difficult. If it happens in adolescence, it could make going to school almost entirely impossible. If you can find any signs that can help you determine if you or someone you know suffers from agoraphobia, physical symptoms, accelerated heart rate, rapid and shallow breathing, feeling hot, breaking out in a sweat, dizziness or diarrhea, psychological symptoms, depression, low self-esteem, fear people will notice your panic attack, fear the heart will stop during a panic attack, and fear they are going crazy from their panic attacks. The best way to know for sure if you or someone you know suffers from this phobia is to seek diagnosis from a general physician. They refer you to a psychologist. Once a person is diagnosed with agoraphobia, they can begin treatment. There are ways to help manage and treat agoraphobia. Antidepressants and anti-anxiety medications are often used to treat agoraphobia. A doctor will change your dose as you make progress, raising or lowering the dose as you go in and finish. And most commonly, a person will only quit taking medication after a year or more after the symptoms are controlled. A person with agoraphobia will also need to participate in a psychiatric or psychotherapy as treatment. If a person has the condition so bad that they cannot leave their house, the therapist may make house visits or phone sessions. To understand the process of treating agoraphobia, you must first understand the condition, acknowledge the problem, and know when and how to treat it. You know if you are at increased risks and how to seek help.